Good? All right, we're here in Strathmore Physical Therapy. My buddy Sam, fellow physio, fellow barbell enthusiast. We're talking today about back pain as it pertains to rec fem. Particularly with lifters, crossfitters, Olympic lifters, things like that. So most of you guys probably know rec fem, one of the four quads, but the only one to cross the hip. Actually attaches on the anterior inferior iliac spine. When this guy tightens up, he can actually pull you into extension by pulling on the pelvis. So if you've already been extended from lifting, which you probably all are, that can just compound that, make that a little worse. So we see this a lot of times when maybe a lifter's squatting deeper than they've been before. Maybe they're adding in a lot more volume on high bar squats, front squats, something like that. So it can be like a volume issue and a load issue, or it could also be like a mechanical issue. So if you can just come in here and get a look at Sam as he squats down, kind of face the wall there for us, Sam, and just come down into a squat. Now Sam's got a pretty nice squat anyway, but if he lets that knee pitch forward and gets a bit sloppy with it, those of you guys who've read Starting Strength, and shame on you if you haven't, but you'll know that Ripto and Kilgore talk about this position. And what they're theorizing is that as the quad is stretching out over the knee, when it pitches forward like that, we're actually tugging on the origin of rec fem up here. So repeatedly doing that, we're going to get that kind of classic low back pain from being overextended. So what Sam can do to kind of fix that, obviously roll the quads. So Sam, show how you would just roll your quads there, either one. So you want to hit it, the whole muscle, particularly up by the hip. So you see stacking his legs for extra benefit. What he can do as well is just flex that knee up. There you go. Get that a little more. If I want to be a good friend to Sam, a good training partner, I can come in, step on him, give him a little more pressure there. Maybe he was giving me some bad handoffs on the bench, or was looking at my girlfriend the wrong way. Just make him pay there a little bit. That's perfect. So that's something he can do himself. From a therapy perspective, these clients are probably going to be presenting with pain on extension. Doesn't really tell us a whole lot though. That could be any number of things. So let's head over to the bed and I'll show you what we can kind of look for in this extension presentation. So we'll get Sam to lay face down, pillow under the stomach. So clients are going to be painful extension. I just want this, popping them up a bit. So I'm going to bring you up a bit, Sam. So when we're looking at rec fem, we're going to probably see a loss of hip extension. So I can come in and just scooch over this way, Sam. I can come in, look at his passive extension here with that leg flat, just let it relax. So if you're getting some back pain here, you might be thinking psoas. And to be fair, with this issue, it's probably a combination of the two. But just for argument's sake, today we're going to talk about rec fem. We might see some painful extension there. All you Maitland guys are looking for that comparable sign. I might actually want to release that, see if he's getting any pain. Let him hinge through the back a bit. These are replicating his pain. I really want to hammer down on rec fem. I'm going to pull the knee up, do the same thing. Is this your pain, Sam? Is this what's kind of been bothering you? That'll let us know, yes, it's rec fem. Treatment-wise, IMS guys, get right in there, that top quad, that rec fem muscle. Let's get you to flip over, Sam. We'll look at some active release stuff. So you're going to need to spin around for me and come down the bed. Let that leg hang off. And I like what he did right away, kept that up, because you don't want both legs hanging off. They're already aggravated in extension. You want to keep Stuart McGill happy. We'll slide those hands under the flat of the back, keep that nice. And this is another chance for me to eke revenge on Sam for all his wrongs that he's done to me over the years. You want to active release that rec fem. You're going to straighten that leg. I'm just going to get my elbow in there on that muscle. I'm going to block like that, because if that slides over the muscle, it's going to be really irritating. I'm going to press down on any knots. Sam, curl your leg in. Count of 5, 4, 3, 2, 1. Perfect. I'm going to do that up and down. If I'm having a hard time sliding off that muscle, I'm going to get the blade of the ulna in there. Dig in. Come on up. Same thing. pull down, 4, 3, 2, 1, and that'll release that rec fem. So guys, hope that helps. You know, check it out, try some of this stuff, and let me know what you think. Hope it helps. Thanks, Sam, and we're good.